was asked to speak on communicating science and how to communicate science to the public. It's a challenge. I think that's true not only for someone who does science journalism, but for public health people trying to get a message out. I'll give you just a minute of background about me. You've already heard some of it. I've been a health reporter for 30 years. I worked for 5 newspapers before I got to the Associated Press. I worked at the Daily newspaper in Biloxi, Mississippi. I was at the Daily in Flint, Michigan. I worked at 2 newspapers in Florida, in Jacksonville and Tampa. The Tampa one is dead now, it no longer exists. And I worked at the paper in Charlotte, North Carolina, the Charlotte Observer. In 2005, I moved to Atlanta to take a job with the Associated Press. What some of you may ask is the Associated Press. The Associated Press is a not-for-profit wire service that was founded as a news-gathering cooperative in 1846, so we're 174 years old. Our customers are not the general public, not directly anyway. We write stories, we take pictures, we do videos, and we sell them to ABC, the New York Times, Fox.com, different other media outlets. They use our content to supplement their content. We have offices in every U.S. state, including Montgomery, and we have somebody in Birmingham. And all over the world, we call our offices bureaus. You can see that more than half the world's population sees news from the Associated Press every day. So there's kind of a look at what we're providing. So we're providing news and health information to a lot of people. At the AP, I mainly cover public health. These days I'm based in New York City, but I still am responsible for reporting on the U.S. Centers for Disease Control and Prevention in Atlanta. And I write about topics ranging from AIDS to Zika, flu, gun violence, lead poisoning, life expectancy, obesity, alcoholism, a range of things. So I'm writing about epidemiology and medical science, and my charge is to write about it on a 7th grade reading level, so that it's accessible to anyone who picks up one of my stories and reads it in a newspaper, on Facebook, or through a link on Twitter. I guess there are a few directions I can go in with this talk. Let's see. These are the 3. Let's try to hit all 3 if time allows. The first one is what do I write about? I can address what do I write about, what kinds of things do we think are important to our customers and our readers around the world, and which do we say, pass, we're not gonna hit that. Second, how do I write about it? What tricks do I use to try to get people to read and absorb what I'm writing? And third, I can talk about, this is a little off of my job at the AP, but I can talk about the U.S. Surgeon General, who's been called the chief health educator of the United States. I wrote my doctoral dissertation was on the Surgeon General, and then I expanded it into a book about the history of the Office of the U.S. Surgeon General and the different people who've had the job. And I've formed conclusions about who is good at it and why, so I could talk about that for a little bit. So number 1, how do we decide what to cover? Well, I'm interested in news. What is news? News is factual information about recent events. So there was a Super Bowl on Sunday night, and the Kansas City Chiefs won 31-20. There is a impeachment trial going on in the U.S. Senate that wraps up today. That's news. More on my beat, there's a new coronavirus that's spreading around the world. Some of the things I write about are things that just happened for the first time, and some are recurring stories. Flu season happens every year, so every winter I'm writing about flu. Every year there's updates from the CDC about smoking rates, mortality statistics, life expectancy estimates. Those come out every year, so that's something that's recurring. When it comes to topics that we keep revisiting, we look for changes that may bring a new facet to an old story or some other new angle. I'm going to talk about for a second something that I didn't write about, but it happened a couple weeks ago, and I thought it was interesting. So the weather. We were just talking about the weather and what's going to happen today, whether there's going to be storms here in Birmingham. People want to know what the weather is. There's weather stories in papers and local media like all the time. You know, do I need an umbrella? Do I need to bring a coat? South Florida sometimes get cold snaps. But 2 weeks ago, a cold snap was about to hit South Florida, and somebody at the National Weather Service did something that I thought was very clever. They put this out saying it's not just going to be cold, but it's going to be so cold that iguanas are going to start falling from the trees. I guess I'm not a biologist, but I guess when they get cold, they basically go into a sort of a sleep-like state. So do you think that this is an angle the media might go for? That's a lot of nods. You're absolutely right. Let's see. And it's not just local media. This is the Washington Post. I'm sorry, I couldn't quite get the screenshot to get, but I cut and pasted it. You can see the lead at the bottom. The lead is the first paragraph of a story. Is pretty straight. It talks about the coldest night in years and the weather, but the headline, temperature in Miami fell to, no, where is it? South Florida sees hazardous cold and falling iguanas. And then there's a huge picture of the iguanas. So, that's national news. And the Miami Herald in South Florida not only wrote about the iguanas the first day, but they kept on writing about them. Here's the Miami Herald. There's the story. The headline was, "Tacos, anyone? Iguanas are falling from the tree." So it became a food story. People are picking up stunned iguanas, and they're cooking them. They call them chicken of the trees. The iguana fixation drew some commentary from media observers. I like this one from David Sampson. He's a source of mine. He worked in the media for a long time. Now he's a spokesman for the American Cancer Society. He imagined the newsroom conversation when the article was first being written. Reporter, "It's the coldest night in 2 years. We're worried about people experiencing homelessness, damaged crops." Editor, "Lead with the falling iguanas." Reporter, "We're talking about tourists to people." Iguanas! So that's an example of a weather story that has legs, as we say in the business. It's not just a one single story on the first morning. It evolves. It keeps going in new directions. It kept going. A more serious example of a story with legs that I've been covering lately is the new coronavirus outbreak that started in China, so as best as we understand it. There's a picture of a screening that's going on at an airport. I believe this is in China. You may know the details. 2 months ago, in central China, people had been to a market in the suburb of the city of Wuhan, started to become sick with a form of pneumonia. Chinese health officials soon determined it was coming from a new kind of virus, which was from the same virus family that gave us SARS and MERS. At first, it didn't seem like it was spreading much, but and that the illness probably was spreading from animals directly to people. But cases began to appear in other parts of China, then in travelers who went to Thailand and Japan and elsewhere, and it soon became clear that it was spreading from person to person. The first case in a U.S. resident was diagnosed 2 weeks ago near Seattle. A few days later, a second one in Illinois. I didn't look just before I came in, but I think the current count is 11 U.S. cases in the United States, and over 24,000 in China, including, I think they're reporting close to 500 deaths. I am one of scores of AP journalists who've been involved in coverage of the coronavirus. Like I said, we have people in China, we have people in Geneva, Switzerland, the other countries. Developments are rapid and the communications can be challenging. Here's an example of how challenging communications can be. This was a press conference held last week in Riverside, California. The U.S. State Department had chartered a jet and sent it to Wuhan to pick up State Department employees who worked at the consulate there, and also offering seats to their family members so they could come back to the United States. And also there were some additional seats that were available to other Americans who were living in Wuhan and wanted to get out. it was, of course, possible that someone on the flight had been exposed to and maybe even infected with the new virus. So originally the jet was supposed to land at an airport in Ontario, California, but very late in the plan, they decided that it would be diverted to a military base near Riverside, California. This is a video of the press conference. I'm going to show you in a second a video of the press conference that was held in Riverside right after the plane landed. The main speakers are going to be Dr. Chris Braden. You can see Dr. Braden at the podium there. He's from the CDC. And Dr. Nancy Knight, also of the CDC. As I understand it, the purpose of the press conference was to inform the public about what was going on and perhaps allay concerns of people in Riverside about that a foreign contagion is landing next door to you, potentially. Early in the press conference, the officials said that the 195 passengers on the plane had been asked to stay at the base for up to 3 days for medical evaluation, and that they agreed happily. Those that they asked agreed happily. But things kind of went off track during the question and answer session with reporters who were asking specifics about the passengers' stay. So it's not a quarantine. Let me ask you, are they free to leave? No. But I got to write the story. They said there's a so that was a trick. That was obviously they had problems, and it was a challenge for us to cover. You may be interested to know, if you don't, that one of the passengers did try to leave that night and was put under a county quarantine order. If you've been following the news, you know that the next day the CDC did order a quarantine for 14 days. No one can leave that base. They're still there. And they said that there's going to be additional chartered flights coming in from Wuhan to the United States, and all those people are going to be quarantined at military facilities too. Also, though, they have also been saying all along that the risk to the U.S. public remains low, which seems a little bit of a mixed message. This is the first quarantine of a large number of people in U.S. history. I'm sorry, a federal quarantine. There were larger quarantines during the flu epidemic of 1918, 1919. Those were city quarantines. Those were locally ordered. But this is a big deal. This is something the government usually doesn't do. It's caused, well, depending who you talk to, people have received this different ways. Some feel it has helped contribute to a little bit more anxiety by the public about this situation. Let's see. Let me go back to slides. What are we at? Let's see. So that's news. What else is news and what isn't news? I get a couple of hundred emails a day. Most of them are pitches. Some of them are product pitches. You know, we have this herbal remedy we'd like, we really think the AP should cover. There's a new drug or vaccine under development. We get pitches from pharmaceutical companies. You should be excited about these phase 2 results. Someone wrote a book. There's a medical person who wrote a book. We think the AP might want to do an interview with this person. Or certain health topics. A lot of pitches are tied to observances. There have been designations. I'm not actually clear on how they come about or how you get officially recognized, but I got one. This is a real one. Did you know it's National Foot Health Awareness Week? I have an expert who can tell people what to do to maintain healthy feet. There are hundreds of these observances. This slide just shows the ones that are going on right now. How many of these do you think I'm going to write about? 0. Once you start down that road, you just can't. I mean, it's not news. Now, if you come to me and you say, hey, okay, it's American Heart Month. I know it's American Heart Month, but I have a new study that shows a surprising new information about how prevalent heart disease is, or how it's been declining, or some other thing that's really kind of a development in our understanding or a change in our understanding. That's news. I'll listen to that. If you have something like that to go with. But when people lead with, it's Cardiac Rehabilitation Week, I don't bite. what else does get me interested? I can't speak for other reporters, but a good trick to use on me is to accentuate the negative. Even if it's a positive story that you're after, you know, we tell stories. We tell true stories, but we tell stories, and stories that compel, that interest people often have drama. It's about a challenge that was overcome. So I'm interested when you talk to me in gritty detail about a challenge that's being overcome. Let's see, hepatitis. So about 15 months ago, I was talking to a CDC official about hepatitis A outbreaks that were going on around the country. And you know, he was making a point. He feels like there's more to tell about the story. And I was saying, I'm not sure that's true. You know, we have people in all these states, and we've been writing stories about each of these outbreaks. And he said, no, you need to understand that this is different. I don't think the AP and other media have really conveyed that what's going on here. It's a different type of outbreak. It's going on mainly among homeless people and people who are drug users. And there's a lot of trouble. There's difficulties that communities are having in trying to stop these outbreaks. But there's also some interesting success stories, including in a few states, not just one. And he said one of the examples is Massachusetts. So we hung up, and I thought about it, and I did a little research. Massachusetts, that's interesting. And one of the biggest cities in Massachusetts is Worcester. It turned out, as I learned from my research, that Worcester has an awful history with hepatitis outbreaks. They've had terrible outbreaks that have happened repeatedly over the last 50 years. One of them, there's a college, Holy Cross, in Worcester, and there was a hepatitis A outbreak in 1969 that was so bad that the team had to forfeit its season because so many players were out with hepatitis A. That was the first time a major college football team had to forfeit a season because of hepatitis outbreak. In medical literature at the time, there were a few doctors in Massachusetts who actually referred to Worcester as Hepatitisville. So we're in late 2018, and after I talked to the CDC official, I was looking at what was going on, and Worcester got caught up in the wave of outbreaks. Worcester had a hepatitis A outbreak, and I thought, this will be interesting. So I'm going to go there. But what was different this time, when I called Worcester and said, I'm an AP reporter, I'd like to come, you know, they talked about, well, yeah, we're doing a lot. Actually, we've established this outreach program where we have, it's a team, and you can see there's a police officer there as part of the team, but others, public health workers, who go out to homeless encampments, shelters, and other places to talk to people, homeless people, who might be at risk for this, to offer vaccinations. This is a vaccine-preventable disease, and really try to make connections, to bring public health to them. And I went along on the ride. You know, this is a photographer that was with me. We took a picture of that, and I wrote a story. And you know what? The Worcester outbreak never really took off, and it turned out to be a story. It was a success story. It was about how this community came together, and they followed lessons that had been learned in San Diego and other places that had earlier outbreaks. And I really liked that story. It was well read, and it wasn't just, you know, cities are, you know, everything's out of control, nobody has enough staff, and things are going to hell. It was like, look at, this is how they overcame a challenge. Okay, so how are we doing on time? You know, let me, I want to do a couple thoughts about topic number 2, which is how I write about science. Within the world of journalism, there have been studies about what people read and how people read. For example, you know, when you put a front page of a newspaper, I'm sorry, I'm old, so I talk about newspapers a lot. Many of you are like, what the hell is he talking about? But there were these things called newspapers, and they used to sell them. They were big, and they had all the news in there. And they did studies in the old days where when somebody picked up the front page of a newspaper, where does their eyes go? Which place? And that kind of helped editors to decide where to place stories. They always looked to the upper, so if this is a newspaper, they tend to look here first. This is the first story. So often, even if there's like sometimes they'll go here, but this is the best place to get your story, because that means the editors think that you're the bee's knees. That's the news today. So where they go first, and there's been research about how long do people stick with an article once they start reading. One of those studies found that if the lead, remember the lead is the first paragraph, usually for journalists we try to keep it to one sentence. If the lead is 5 words, reading comprehension is 96%. U.S. soldiers invaded Iraq today. 5 words, everybody gets it. You know, if the lead is up to 17 words, reading comprehension stays as high as 85%. After 17 words, it's off a cliff. People are like, they look at it, they see this big paragraph. It's like going to the bookstore and I'd like a nice novel, but oh, it's 1,000 pages, I'm not getting it. They move on. A lot of people don't stick to it. So when I try to write short, and I try to write punchy, and I try to bring them in less than 17 words. You probably heard about elevator pitches. Maybe that's something you guys talk about. That's the journalistic equivalent, the lead. You want to get them, you want to summarize it quickly, you want to get right to the point, and you want to draw them in. And I try to use plain language. Most of my audience will likely only have a glancing knowledge of medical science or public health. And so the jargon of a specialized field is not something I want to use. I remember one time I was working on an article about the Gulf oil spill in 2010, just the Gulf down, and I wrote a draft that used the word toxic. And it got kicked back to me with a question. The editor said, if I was going to use the word toxic, I'd have to explain it. And so this was not a technical discussion about whether I could correctly say that crude oil contains certain compounds that have a median lethal dose of 500 milligrams per kilogram of body weight when administered to rats. This was a question about what is toxic? Can we say poisonous? So what the editor was saying was we need a word that's even more friendly. And if I'm getting questions about the word toxic, you can guess how far I'm going to get if I put in my story words like prophylaxis, virologic, symptomatology. You may be interested to know that I cannot get the word epidemiologist in an article. I cannot get the word pathogen in an article. These are not words that pass my copy desk. So I've got to use plain language. If I'm looking for an expert, if I call the University of Alabama at Birmingham and I say, I need an expert to help talk to me about coronaviruses, I need to help explain to the reader what is understood, what scientists understand about this. And if they put a professor on the phone with me who's using jargon, I can't use their direct quotes. If they keep saying pathogen, epidemiology, and even words that are even more specific to their field, I'm going to have to stop, I'm going to have to paraphrase. If you're a careful reader of national public health media coverage, you will probably notice that there are certain people who come up over and over and over again in different stories. They're quoted. The New York Times story has this guy, the Post story has this guy, ABC has this person on camera. Some of the names, William Schaffner at Vanderbilt University on vaccines and infectious diseases, Tony Fauci at the NIH, Art Kaplan at, he does bioethics, Mike Osterholm at the University of Minnesota on preparedness. These are people who, so I'm a reporter on Deadline, I know that I can call them up, I know they're going to call me back very quickly, and I know that they're going to summarize succinctly what's known or important points to make about the coronavirus thing or some other nuanced and complicated story. And I don't, with 30 minutes to go before I have to file, I don't have to stop and go, okay, I have to take the quotes away and I have to reword what he said so it's more plain spoken. I can quote them directly because they're good at that. Okay, so now on the topic of who's good at communicating science, I'm going to segue to the Surgeon General stuff. So I wrote a book about the U.S. Surgeon General. The Surgeon Generals, or actually they say Surgeons General. So if I say that, I'm not being weird. That's how they say it. Surgeons General is the plural. Why, of all topics, did I spend 7 years of my life researching and writing a book about the Surgeon General? I'll tell you how it got started. From a class discussion at the University of North Carolina in 2005. I had my journalism degree, I had my MPH. I decided to go back to school to the UNC, the doctoral program, the same program that Paul Irwin was in. We had this, it was Tom Ricketts. It was Professor Ricketts, who's kind of this offbeat professor, and he was leading this sort of offbeat class discussion about, he asked us this question: if you were writing the story, this is very appealing to me, if you were writing the story of public health today, who would you say are the protagonists? Who are the heroes of public health today? So here's a hero. It was really interesting. So I was very curious what my classmates were going to say. And they started talking, and somebody brought up the current health official, like the CDC director and the EI, the Epidemiologic Intelligence Service, the people who, and the state health workers who investigate and try to deal with outbreaks and other things. Somebody brought up the trial lawyers, because you remember in the 1990s, the trial lawyers did the tobacco settlement agreement that brought a lot of money to states to help prevent smoking. Remember, this was a conversation in 2005. Somebody said Bono, the lead singer of the rock group U2, which, I want to say YouTube. It's been that long. Who at that time had been traveling around in Africa trying to draw attention and resources to the problem of HIV there. So I was listening to this conversation, and I was thinking, hey, that's funny, nobody's mentioning the Surgeon General. Oh, by the way, for a prize. Everybody, if you know the name of the current Surgeon General, could you hold your hand? Raise your hand. I get to keep the prize. Okay, thank you. Well, I grew up in the 1980s when this guy, C. Everett Koop, was Surgeon General. Those of you in your 40s are maybe with me. Those of you younger may not. But C. Everett Koop was this larger-than-life persona. You could see he had the face and demeanor of an Old Testament prophet. And for years, he hammered away at the tobacco industry. He called for a smoke-free society by the year 2000. And he was Surgeon General when AIDS first emerged. And those of you who know your history know that the federal government was widely criticized for seeming to be indifferent to it. It's not true. People at CDC were working, there were a lot of people who were working very hard on it, but the Reagan White House and others were seen as being indifferent to it. It's a gay disease. It's God's wrath on the gay people. It's not something we heterosexuals have to worry about. C. Everett Koop led a compassionate public health education campaign on the emerging AIDS epidemic, saying, we can all get this. This is a problem we all have to deal with. You can see there's he put a pamphlet. He personally wrote a pamphlet that was mailed to all Americans. There's a newspaper cartoon where it talked about sex, frankly, and you can see Martha has keeled over by the frankness of the pamphlet. He was a household name. He was a public health rock star. He even wore a uniform. The Surgeons General didn't wear a Navy uniform at that time, but he brought it back. So he had a uniform. He was the closest thing I'd ever seen to a comic book version of a public health hero. When I was growing up, my understanding was Surgeons General are big deals. They're important. They mean a lot. But here we are in 2005 having this class discussion, and nobody mentions the Surgeon General. And I thought, whatever happened to the Surgeon General? That's a question that was the focus of my dissertation, which I expanded into the book. And I did this research, and I learned that at one time, Surgeons General actually were more politically powerful. They were, this isn't exactly right, but they were more along the level of the HHS secretary. But gradually, for political reasons, those powers were stripped away, and what was left to them was their bully pulpit. They were still used as spokesmen for the government on important public health issues, and that's where Koop thrived. And I learned that whether a Surgeon General made any big impact, as best as a big impact can be measured, that kind of thing, hinged on two things. One of them, it hinged on the person who held the office, his or her ability to speak and persuade, and then also how much slack they were afforded by their political bosses to go address topics like AIDS or other things that were controversial. So it's impossible to really say what impact a Surgeon General has on any particular topic, smoking, for example, because a lot of things were going on with smoking while Koop was Surgeon General. You can't say Koop is responsible for the 20% reduction in the U.S. smoking rate, adult smoking rate that happened when he was there. But I was able to look through medical journals, newspaper clips, Gallup surveys, and other things to see to what extent the Surgeon General was showing up and that people were reacting to what he or she said. And looking at the Surgeons General, you know, I began to form opinions about who stands out. And if I had to group them together, the theme I came up with was who stands out are the people who had guts. People who didn't just repeat, you know, a health observance or, you know, everyone should, but they waded into controversies that the public was uncertain about. They didn't know. They were getting conflicting information about the dangers of this, the dangers of that. And the Surgeons General who really seemed to have some resonance in the public's mind were those who took those issues on and forcefully communicated what science said about it, and in some cases what should be done based on what science is telling us. So who else stands out? Dr. Luther Terry, of course, is always going to be one of the most famous Surgeons General. Dr. Terry, who is from Red Level, Alabama, one of the most famous Surgeons General because it was he who released, he convened an expert panel and released their report in 1964 on smoking and health. At the time and before that he released this report, about half of US adults were smokers. You smoked on planes, you smoked on buses, there were ashtrays in every room you went into. Smoking was very common. And though there was a fair amount of research out that connected cigarette smoking to lung cancer and heart disease, the cigarette industry had done a very effective job through advertising and other things trying to sow, I don't know, when you're not sure, what's the word? Somebody help me. Yeah, they made people a little unsure about, well, how bad is this? They were trying to communicate, hey, the science isn't actually settled on this. When Dr. Terry issued the report, and he did it with great fanfare. It's a great story about how he convened this press conference, and he closed the doors, and the reporters came in, and they were given 1 hour to read it, and it was on a Saturday, so this is back in the days of newspapers. So, you know, the Sunday newspaper was the big paper. Everybody read the paper, so he made sure that the news hit newspapers across the country on Sunday, and that, by many accounts, changed the national conversation about smoking. The science is settled, he said, and that was the tenor of the conversation after. Who else? This is Dr. Jesse Steinfeld. He was the Surgeon General that Richard Nixon appointed. He is largely forgotten today, but he gave a huge push to a national movement for non-smokers' rights by drawing attention to the dangers of secondhand smoke. Now, at the point, so this is a few years after Terry, and at that point, okay, people were accepting people who smoke, it's bad for them, but it's them. They can smoke. You know, if the person in the room says, hey, I mind if you smoke, the smoker might say, I'm hurting myself. Well, it doesn't matter what, stop being a whiner. And a lot of non-smokers were being dismissed. Steinfeld became their advocate and talked about the importance of that. Tobacco companies hated this guy. They really did. Who else? David Satcher, also from Alabama. Alabama's had some very good surgeons, so great Surgeons General. David Satcher was the second Surgeon General appointed by Bill Clinton. He's from Anniston. He issued an amazing array of reports on a variety of topics, but perhaps the most controversial was one on sexual health. It found, for example, that there was no good evidence that teaching abstinence to teens prevents them from having sex. It also said that you should be in a monogamous sexual relationship, but it doesn't have to be with a spouse. These are things that were controversial at the time. And in the wake of the Monica Lewinsky scandal, the Clinton administration was not interested in seeing the issuance of a Surgeon General report on sexual health. Thatcher's term carried over into the next presidency, George W. Bush, and the folks in the White House there felt this was not they weren't really excited about this either. They said it was not in keeping with the social values of the White House. But Thatcher got it out somehow anyway. It drew a lot of attention, and he was then sidelined by the Bush administration, and his visibility went way down, except during the anthrax scare of late 2001, when there were a lot of missteps by the HHS secretary, and they needed somebody who was better at speaking to the public about a crisis like that. He was brought back for speaking on that. And last but certainly not least, the one I want to highlight is Dr. Joycelyn Elders. She was the first Surgeon General that Clinton appointed. She lasted in the job 15 months. She had the job for a shorter period than any other Surgeon General. If you believe that a Surgeon General should wade into issues and speak truth to power, scientific truth to power, here's your girl. Nobody did that more aggressively and more bravely than Joycelyn Elders. Should marijuana be legalized? Reporter asked her. She answered the question. Should we have more gun restrictions, more restrictions on gun ownership? She told you point blank what she thought. Should we teach kids to masturbate? She answered the question. That last one cost her a job. Social and political conservatives went ballistic. She became a campaign issue, an important campaign issue, in the 1994 midterm elections. Rush Limbaugh attacked her on a weekly basis on his show. Saturday Night Live did a skit about her. She was well known to the public. If I asked you in 1993, can anyone name the Surgeon General? You'd have all gone like this. She was fired after the White House decided she was too much of a political liability, whether she was right or not. But I bring her up not just because she was controversial. As a journalist, I'm interested in controversy, but not only that, but she was good. You know, in my research, I went back and I looked at videotapes of when she was speaking. And she used alliteration and powerful imagery and spoke in the manner of a preacher. She was talking science, but it was like the words of God were coursing through her. There was one, she gave a speech at the CDC, and she got 3 standing ovations. I've covered CDC for 15 years. It's a group of scientists. This is not a raucous, jump to your feet kind of crowd. They were for her 3 times. She's fascinating to me, not only for how she did her job, but how her example is interpreted by different people. When I was working on the book and I'd interview different people, and one of the questions I'd ask, sometimes as an icebreaker, well, who do you think was a good Surgeon General and who did you not? You know, this was the litmus. I mean, people felt very strongly one way or very strongly another. There was a significant number of people I talked to, public health professionals, who said it was not good. She was not a good example. She didn't get much accomplished. She wanted to establish health clinics in underserved schools. That's the reason she took the job. That's something she wanted to accomplish. She was fired after 15 months. She didn't get it done. And some people feel that her example, I mean, Clinton was a moderate Democrat. And if Bill Clinton would fire a Surgeon General for being outspoken, what can we expect how some other presidents that have come since then will react to somebody like that? They feel that her example has caused Surgeons General since then to shy away from controversy because they can look at her and say, if I speak up on this, I'm gone, and I can't get this done or I can't get that done. But what do we lose when we have a Surgeon General who doesn't do that? The anti-vaccine movement has flourished over the last 20 years. Gun deaths have increased, obesity's increased, life expectancy after decades of steady growth went down, fell for 3 years. That's the first time that's happened since the 1910s. It just picked up, the news a week or 2 ago, it just went up again. But we had basically a 3-year trend of decrease. That's something we hadn't seen since the flu epidemic in World War I were killing hundreds of thousands of people. Now, could a Surgeon General have stopped these things from happening? Probably not, maybe not, but they could have tried. I bring that up because you are future public health leaders, and I think it's something you should consider when you're on the hot seat someday and you have to make decisions about communicating science to the public and what's important and what needs to be said.